over 100 years, influenza has been making people really sick, but we still don't have any targeted treatments.
The flu is a disease that's caused by the influenza virus, and it starts out similar to a cold, the common cold, but it can progress to be quite severe, especially in older people and in children and immunocompromised people. So these might be people having cancer therapy or that might have an underlying disease which make them more susceptible to these viruses.
So the influenza season used to start in May. However, what we've found since COVID in the last couple of years is that the season is starting earlier, so it's actually starting around March.
In a healthy person, they can still get the flu. They might get cold, cough, fever, chills. However, in children, we tend to see a few more vomiting, diarrhea, and gastrointestinal symptoms as well. If you're a healthy adult with no underlying conditions, the best thing you can do is just stay home and rest. Keep yourself away from other people if you can. This means not going to work or the supermarket, and just rest. In an elderly person or immunocompromised person, this can progress to be very severe. So they might have to go to hospital and they might have difficulty breathing, and it can be very serious for these people.
When someone comes to hospital with severe flu, there are currently no treatment options that can specifically help them.
We have seen that younger people are getting influenza more, and that is because vaccination rates are dropping. Since COVID, we've seen less children under the age of 5 receiving their yearly vaccine, and that leaves them open to getting the flu each year.
The influenza vaccine is the best thing that we have to protect us from getting severe flu. And the influenza virus can mutate really quickly. And what that means is that if you get the vaccine one year, it may not protect you in the following year. Also, your immune response may only last for a certain amount of time. So it's really important that you get a vaccine every year to boost that response. We're trying to understand why certain people get severe flu and work out how we could treat them with new drugs. With more funding, we could identify new treatments for influenza and ensure that we are better prepared for the next pandemic.